Hi guys, it's Lisa. This week I'm presenting GI soap note. Sorry about my look, just woke up. Anyway, VH is a 32-year-old Hispanic male. He came in with his chief complaint of, I get a bad stomach ache after I eat. So he's, again, like I said, 31-year-old Puerto Rican male, presents to the clinic he wanted a full physical, and then in talking to him, he went with his complaints that he has frequent abdominal pain and bloating, especially after eating. It's been going on for about a month. Usually occur after large meals and when he eats trash food. He states he works as a barber, doesn't really have time for a full meal during the day, so a lot of snack eating and usually not healthy food. As he says, he goes to fast food restaurants a lot and eats large quantities because it's so infrequent. He denies any vomiting, black or bloody stools, does admit to occasional diarrhea. He denies any cough, cold, or upper respiratory symptoms, otherwise healthy, takes no medications, no significant medical history, admits to occasional ibuprofen 1 to 2 times a week when he's just not feeling good or gets like a headache. And he denies any pain, worsening pain when he lays down, and he's not awakened with this abdominal pain. So as I said, he doesn't take any medication. He's not allergic to any food, environmental, any kind of weird allergies or anything. He's up to date in all his immunizations. He goes to CVS to get all those and make sure he maintains them since he's working with people. No hospitalizations, no surgeries, no chronic illnesses or any traumas. He works as a barber. He denies tobacco, but he does drink usually on his weekend, which is different. But anyway, on his weekends, and he admits to just beer. Constitutionally, afebrile, no weakness, no malaise. Skin, hair, and nails. Denies any hair thinning, any changes in his skin, any dryness or scaling. Head and neck, denies any dizziness, trauma, head or neck pain. His eyes, he does wear glasses. And his last eye exam was 6 months ago. So he wears his eyeglasses. He denies wearing any kind of contacts. Ears were, he denies any pain, hearing loss, or tinnitus. Endocrine, no polyuria, no cold or heat intolerance. Nose, sinuses, no rhinitis, no deviated septum, no loss of smell or any kind of sinus pain. No sores, pain, or loss of taste in his oral cavity. Cardiovascular, denies any chest pain, irregular heartbeats, any shortness of breath, palpitations. He denies any shortness of breath with or without exertion, and no cough. He does admit to the epigastric pain that comes and goes, sharp inside his stomach, and comes after he eats large meals. He admits to feeling bloated and then the occasional diarrhea. He does deny vomiting, constipation, black or bloody stools, as I stated above. No genital urinary symptoms at all, no dysuria, no frequency, no incontinence, no neurological problems, no seizures, headaches, or paresthesias, other than his occasional headaches he gets maybe twice a month. Musculoskeletal, denies any joint or muscle pain, has full range of motion. Psychiatric, denies any depression, anxiety, or loss of memory. And lymphatic, no bruising, no swollen lymph nodes that he knows of. And he denies any food, drug, or environmental allergies. Kind of went through all that. Social history, he lives in a 1-story home in El Dorado Hills with his wife. He does live close to his parents, which he eats with a lot. He graduated from high school, and he eats a typical Mexican diet, Puerto Rican diet, lots of beans, rice, and red meat. He loves the outdoors, but doesn't get out much due to his work schedule. He doesn't practice any alternative healthcare practices. He is Catholic, does not go to church regularly. He reports sleeping at least 8 hours a night. He is sexually active with his wife, and they're in a monogamous relationship. And again, he drinks beers on his days off, his weekend, and about 4 to 5 beers at a time, and that's about twice a week. He denies tobacco, he denies illicit drugs, showers daily, practices good hygiene, denies any depression or suicidal ideation. Safety-wise, he denies any abuse or bullying. He does admit to having weapons in the home, but they are locked up in a safe, and he states he wears a seatbelt. His mother and father are both alive. His father's 61, has hypertension and diabetes type 2, and his mother is living. She has hyperthyroidism and GERD. He has one sibling, is 28 years old, and reports no health issues at this time. His vital signs today were 98.0, temperature, respiration 17, blood pressure 122/74, heart rate is 74. He is 72 inches tall and 172 pounds, which puts him in a BMI of 23.3, and denies any pain when he came in. My general survey, he's a healthy appearing adult male and no acute distress. He's alert and oriented and answers all my questions appropriately. His head was normal cephalic, hair was thick with normal distribution, no nodules or deformities. His skin tone was normal, warm, dry, and intact. Nail beds were pink with no abnormalities also noted. Eyes were pearla, ears were symmetrical with normal exam, nose and sinuses normal exam, mouth and throat normal, neck, trachea was midline, supple with no abnormalities, no JBD, carotid pulses were strong. Chest was normal, no clicks, S1, S2 were present, and it was regular. Respiratory rate was normal, breath sounds were absolutely clear. His GI was soft, mildly tender abdomen on palpation. Bowel sounds were active in all 4 quadrants. No hepatosplenomegaly, and Murphy signs was negative. No urinary symptoms. Musculoskeletal was MAE and full range of motion. Neuro was completely intact. So my plan, what I did is I ordered a CBC. I did a stool guaiac test, which showed no blood, and considering an EGD, and sent off an H. pylori just to be safe. What I ended up ruling in was PUD, and I did that over GERD and stuff was because of his pain worse after eating instead of being relieved with food. And then also that it doesn't wake him up. He's not waking up with a cough in the morning. Tells me it's probably not GERD. So I ruled out GERD. I ruled out cholecystitis, and I went with the PUD. I referred him to GI for an EGD just to be on the safe side. I started empiric treatment for the PUD. I did famotidine while we wait for the H. pylori test to come back. I also thought we could maybe try some Prilosec, 40 milligrams daily for 14 days to kind of see if that will help out a little bit, and kind of continue from there. Follow up in 10 to 14 days, probably sooner with when I get the lab results so I can review them with him. That was him, and I look forward to your feedback. Thank you.